said, I'm gonna bring it where you at, you put it back.
Okay, so we have a trach that's out,
Uh-huh.
and this little girl's trach dependent. She pulled it out herself. Is that right, Grandma?
Mhm.
All right. Generally, if it's not a crashing kid, what are your steps? What are you going to do?
So you generally want to make sure you have all your supplies ready so you're not scrambling for anything. Put the ties on, makes it easier. You don't have to do that, but for us it makes it easier to have the ties ready to put the trach on emergently for a patient. And you want to make sure you have the obturator placed to give the stiffness to the trach so that you can advance it.
Yeah.
It also will occlude that so that you can put the lubricant in there without getting lubricant in the inside of the trach. So ideally you want them laying flat on their back, and we're going to put a little behind the shoulders
Okay.
so that we get, there we go. Hey! A little extension of the neck to make it an easier process. We'll go ahead and put the trach ties on.
Okay.
Yeah, she get the spray back up. Y'all know what, I think.
So you put the trach ties on first?
Yes, sir. We want to be careful not to touch that end since that's a clean end.
They call from the adult side saying, hey, y'all got a kid with a trach out. I'm running out and they're looking for somebody. Nobody was running, so I'm like, well, it must be okay because nobody's running.
And then to make it slide in easier, we're going to put it inside some lubrication.
I said, Andrew, hit that toe and let me know you're all right. Just hit that toe.
You want to make sure your obturator's in.
Okay.
And with the patient, you want them straight like this, and with her, so then you're just going to advance. And this trach's been out a little while, so we're going to try and gently go. If you meet resistance, you don't force it past there. We don't want her to false track. So we advance slowly. And
Is there any hand movements you make? I mean, or do you just go straight in?
You just kind of want to make sure that you're following the airway. So
Yeah.
the trachea is going to go straight down. So you just, as soon as you get it through the hole, you're going to start to curve down.
Curving down, okay.
There are different techniques. Some people take the trach and just go straight down with a curve. Others will come in from the side, and as soon as they're in the hole, they'll turn it down.
They'll turn down.
Hey, baby. And there we go. I'm just going very gently, making sure that as I meet resistance, I'm not pushing any further.
Absolutely.
Let me get a little more lubrication. We don't really know how long this trach has been out. You're doing so good. She's doing great.
She is.
I'm trying to find exactly where the airway
Sure.
is.
Now, would it help if her neck was hyperextended a little bit more, like more padding under her shoulders?
It could. I'm trying to lift it on her shoulders with my hand, and I don't
see that, yeah.
She has a lot of scarring, so I'm trying to see if the opening is higher or lower. It's right there.
What a big girl.
There it
Oh,
is.
there's your opening.
Can we get some suction, please?
All right, suction coming up. You want to get a gauze and wipe that off?
Yeah, gauze
Yeah.
would be fine. Clean gauze.
Can we get a clean gauze? Yep.
Okay, sweetheart.
Now, do you want more padding under the shoulders?
I don't know that that's gonna. We can, yeah, if you want
Okay.
to try it, but let's get further up
Okay.
under her back.
There we go. There we go.
Okay, baby, lay back. Come here, come here.
There
That's a
you
good girl.
go.
There we go. Sometimes hyperextending makes it
harder.
worse. Yeah. I have a feeling this trach has been out a little while. It's okay, princess. Come here, baby. Come here. There we go. There we go. And then we pull the obturator out quickly. It's okay, princess. It's okay. It's okay. so that she can breathe. And we're going to secure the trach ties. You can hear the air moving in and out.
Yeah.
So we know we're in the trachea.
Okay.
There's no bleeding, so we know there's no false tracking. And we want to secure the ties to where it's tight enough to just put in a small finger here.
Okay.
Okay, Princess, come here. Come here. Hey, it's okay. It's okay. And that's it.
So what would
Pressure
happen if
source.
we couldn't get the airway in? What would be our options?
So the
the
options
trach
with the
in.
trach, here at the hospital, we have the standard that at the bedside of the trach patients, we always have a smaller size trach as well. So
Okay.
your first step would be to go to this patient at a 3.0 trach. We don't have a whole lot that's smaller than that.
Yeah.
So your backup might be an ET tube.
Okay.
And we could go, we have the 2.5 ET tubes here in the hospital, and you could advance that.
Okay.
And you could use a bougie. Sometimes I've seen ENT put that in and then follow that down, which sometimes works. But worst case scenario, if nobody could get it in, most of those patients can be intubated unless they have been surgically repaired where you can't access to the
Intubate
upper.
from above.
Yes, so you
Yeah.
can intubate
And,
orally.
and most of them can bag. They can bag
And
valve.
yes, and you should bag them, but always remember that when you're bagging, you just would use a regular mask, but when you're bagging, the air is escaping, so you must occlude the stoma.
Yeah.
So that, and you want to make sure that you bag sufficiently to get chest
Chest-
rise. You okay, big
You want to smile for us, big girl?
Can you smile?
What a sweetie.
There's a big girl.